right, so we're going to finish up by talking about our spondylolisthesis and spondylolisis tests. So when we're talking about lumbar instability and actually having one vertebrae have a fracture of the pars interarticularis, either unilaterally or bilaterally, and then remember the spondylolisthesis is when there's actually slippage of one of the vertebrae on the other, typically the top vertebrae on the lower vertebrae. And so the first test that you would do for this, and mind you, none of these have very good sensitivity and specificity, which is kind of disappointing, but they're the best tests that we have next to the lumbar instability test that we already discussed. And so the first one is the one-legged hyperextension test. So they just cross arms across their chest, stand on one leg, and then they're going to extend back as far as they can, and you just kind of give them light support. And if they complain of pain, then that's something that you're looking for. And so you just tell them, let me know when you have pain, and then you would note that and also ask where the pain is when they do it. The next test is the Kemp Test, and all they're going to do is stand on both feet, and very similar to what they just did, but they're going to extend and rotate back. And again, both of these would be done bilaterally. And again, you're asking for the exact same thing. Do they feel pain, instability? And it should be in that particular segment, not running down their legs or going up or anything like that. It should be really localized. And then the last one is a step-off deformity. So we've talked before about finding the spinous processes. So again, you would start on S1 and see where that sits. And actually, will you hold your shirt for me, please? You would find S1, and then you would come and find L5, and then L4, and then you would work your way up as you're going on your patient and see if you notice that one of the spinous processes is sitting anterior to the spinous processes above and below that one, and that would be a positive step-off test to again indicate that the people, that wouldn't be just a spondylolisthesis, that would definitely be a spondylolisthesis because it indicates actual anterior slippage of that vertebrae.